Hello, my name is Myles Harris and the title of my presentation is Space Health and Disaster Risk Reduction. My background is that I'm a nurse and my Master's was in Education. I'm currently a PhD student at University College London in Risk and Disaster Reduction. The topic of my PhD is prolonged field care, which is the provision of healthcare in very remote environments that have limited accessibility and access to resources. This research is in collaboration with the British Ministry of Defence, the Royal Centre for Defence Medicine. Within UCL, I'm also one of the coordinators of Space Health Risk Research Group. On the 1st of September 2021, the research group led a symposium on space health and disaster risk reduction. This symposium was funded by UCL Grand Challenges. We had 240 people book tickets and participants throughout the day from Australasia, Asia, Europe and North America. The symposium was a theoretical exploration of how healthcare could be provided during the exploration of another planetary body and how learning from this practice could be applied to remote environments on Earth. The focus of the symposium was on interdisciplinary healthcare practice. The rationale for this is in remote environments on Earth, the resources, which include healthcare practitioners, are very limited. Healthcare practitioners are usually trained in a specific health discipline, for example, medicine, nursing, or allied health. In urban and hospital environments, healthcare practitioners work together to meet all of the patient's needs. However, in remote environments, consultation with other expert members of a multidisciplinary team can be difficult, and resources are extremely limited. As a result, healthcare practitioners need to be able to provide interdisciplinary healthcare autonomously with those limited resources in order to meet all of the patient's needs in that remote environment. These challenges are very similar to providing healthcare during the exploration of another planetary body and in the field of space medicine. Resources are extremely limited, telecommunication back to planet Earth is unreliable, and there's usually one healthcare practitioner that will be required to meet all of the patient's needs during the space mission. Interdisciplinary healthcare is therefore very important for providing healthcare in remote environments on Earth and during space missions. During the symposium, we examined the concept of interdisciplinary healthcare through 5 perspectives of health. The 5 perspectives were space medicine and space health, global health and public health, planetary healthcare systems, including medicine, nursing, and allied health practice, anthropology, and the disaster sciences. The paper reports on the risks to health and the challenges of interdisciplinary healthcare. The risks that were highlighted during the symposium were a mixture of physiological, psychosocial, and environmental risks. Healthcare providers will need to be aware of all of these risks and how to mitigate them in order to promote and protect good health and well-being during a space mission. Some of the risks that were highlighted are specific to space, such as exposure to radiation and also long periods of time in zero or low gravity. However, many of the risks in space are aligned with risks in remote environments on Earth. One example is long periods in isolation, which can be damaging for mental health, and this has been resonated recently during the COVID pandemic. While there is ongoing research and evidence of risks to health in space, there's minimal literature that applies this research to interdisciplinary healthcare. This research gap is one of the challenges to interdisciplinary healthcare in both of these contexts. Another challenge that was highlighted during the symposium is the need to foster a learning culture between members of a multidisciplinary team in healthcare in order to inform each other's practice to be able to be applied in remote environments and also eventually in space. More research is therefore needed in this area, which leads on to the second project that UCL Space Health Risk Research Group is currently leading. This project is an analogue space research mission. While there's been some robotic analogues, never before has there been a human analogue research mission to take place within the UK. During the symposium, the participants were asked to develop realistic healthcare scenarios that could take place during the exploration of another planetary body. These scenarios are going to be applied during the analogue mission through 3 case studies. The analogue astronauts, who will be a variety of different healthcare practitioners, will need to provide interdisciplinary healthcare to the patients during those 3 case studies. The analogue mission has been designed to simulate three key features of space. Number one is the exploration of another planetary body. The analogue mission will take place in a remote and uninhabited Scottish island that none of the analogue astronauts have been before, therefore simulating the exploration of another planetary body. The second space feature is limited access to medical resources, and during the analogue mission, the analogue astronauts will also have limited access to the in-simulation medical resources that they'll need during the case studies. Thirdly, delayed communication between astronauts and mission control on Earth will be simulated during the analogue mission by delayed communication between the analogue astronauts and the mission crew that's on the island. One of the main studies of the analogue mission and the research output will be an evaluation on how the analogue astronauts provided interdisciplinary healthcare during that simulated space mission. Thank you very much for listening to my presentation. If you'd like to hear more about the research group and the work that we're doing, please feel free to send us an email or visit our website for more information. I hope you enjoy the other presentations of the symposium.